The COVID-19 pandemic has been disrupting the lives of billions across the world. Yet how refugees and immigrants are coping with the situation has been grimly reported. Weave Tales has partnered with Florida Immigration Coalition and We Are America to find out how these communities are dealing with the epidemic through the voice of their leaders and to discuss what needs to be done for now to better protect their lives.
Is Camila. I was born in Venezuela, and in Caracas, Venezuela. I moved to the United States when I was 14 years old, and because of the economic situation in my country, it was hard for my mom to find a job. Violence was really hard, and it was just a very unstable time. So we decided to come to the United States and apply for political asylum. We've been here since 2013 now, so we've been here quite a while, and since 16, I've been organizing with bigger organizations because I saw the need of my community to have a voice as an immigrant. So I've been doing immigrant work around reproductive justice, immigration rights. So yeah, it's a little bit about me. So it's been hard to cope with COVID-19 because I see my mom go out in there and work every single day, because she still has to work. Her job still requires her to work. She's an essential worker. She works as a domestic worker too. So she has to go there to make money. And also personally, not being able to go outside has affected me in a way. You don't realize how much you contact with other people. I live by myself mainly and other roommates. So not being able to go out there and talk to like friends and family has been hard. Especially right now, my birthday, I wasn't able to spend much time with any friends or any family members. But it's also been very, very amazing to see the way that our community has responded and has been there for each other. I see my friends and even family members driving each other to like work so that they don't have to take the bus and they don't have to take the train. I also seen even like my roommates driving groceries for their grandparents and their family member. I've seen our community create funds and try to find as many support as they can for other essential workers, like construction workers and domestic workers. And I'm just very, very glad to be part of this amazing community that's here for each other. So as I said, my community is mainly made of construction workers, domestic workers, essential workers, people that work in the grocery stores, and they still have to go out there and they still have to put themselves on the line. And it's really hard to see big organizations like Publix not allowing their employees to wear personal protection equipment and putting themselves at risk of something, or putting other customers at risk, and having to go out there and work. And it's just been hard on my mother personally. And there's always that worry of like, am I gonna get sick today? Am I gonna be something to my children today? So it's been really hard by our community, and it's been really hard for other workers to have to go out there and put themselves on the line in that time like this. Definitely has triggered feelings of uncertainty and what is gonna happen. We don't know. I remember growing up in Venezuela, there was always a fear of uncertainty, and because of political instability. Also, something that really triggered me was walking down the aisles when there was no food or any toilet paper or any like essentially products, because it triggered memories back from Venezuela when there was food scarcity and it was really hard to find products, like basic need products. So that was really hard to see, and also a lot of fear. Something that interview from the show mentioned a while back was that she was fearful that she was going to go inside her house and say goodbye to like or a family member and then never see them again. And that's something she back with her refugee story, and I connected with that, because you might say hi to a family member or friend when you leave your country, but you might never again. And that was a big trigger too. So I still have family there. I still have a lot of family in Venezuela, and my dad still lives there. Um, also have many friends, and it's been hard to see. No, as I said, not many of them cannot go to work, so they have to put their bodies on the line. Venezuela doesn't have a good infrastructure for medicine. They don't have a good medical system. It's already been hard for many of them to basic need products. It's already been hard for them to get insulin or even anesthesia for surgeries. So I cannot know how a crisis like this is going to impact the country. And it's something that I know my mom can sleep at night. She's so my cousin. She's so worried about my aunt. She's so worried about her own her own mother's family that are very elder and they don't have a support system that will take care of them. So it's been hard, and we are doing everything we can to stay informed and to try to support as much as we can. But there's nothing we can do but be present and to stay there for them. So as I mentioned before, I love our community and how supportive we've been. I love seeing everybody just becoming so creative to support each other. I see sewing their own masks and sending it to essential workers. I see people driving their family members or like going to food banks and picking up food and like distributing it among the community. And I think it's so beautiful. But something specifically that I think is it gave me so much hope was there was this case in a detention center here in Broward County, and it was a Venezuelan refugee that was detained in Tampa while she was driving without a license. And they sent her to Broward County, but she suffers from diabetes and she has respiratory problems. So she was very worried she was gonna just with COVID-19, but thankfully to community work and to the circle of protection work and to the deportation defense work, we were able to get her out of the detention, and now she's safe and back with her family, and it's so beautiful to see. And I wish that could be something that could happen for all immigrants in detention right now. So as I said, a lot of immigrant workers and refugee workers work in construction, or they're essential workers, they're sanitation workers, and they don't have proper equipment. They're not given proper equipment to protect themselves. So they expose themselves to this virus every single day, and they could bring it back to their family and really affect them. Many of them don't have health insurance, and it would mean that it could be a fatal disease for them. And so that's a very important need. Also, more support for our communities that have lost their jobs and that are now at home and have anything, and they're worried about where they're gonna get their paycheck. They're worried about how they're gonna feed their families. So definitely more support for communities and immigrant communities that are not gonna receive any financial aid and are right now at their home worried how they're gonna. So I think just staying connected and just checking in with each other, seeing what our community needs, seeing what our neighbor needs, just trying our best to stay informed, also inform our communities because there's a lot of misinformation going on, and just staying present and trying to read as much as we can. I think that's the best we can do right now.